So my name's Abigail Batchelder. I'm a current postdoc here at UCSF. I'm actually with the TRIM postdoc through the Osher Center, and I am focused. I'm a clinical psychologist with a training in public health as well. I'm very interested in thinking about the way emotion and substance abuse contribute to engagement in high-risk behavior and self-care. I always really enjoyed science. I really liked it as a kid. I got really into it. I would say in early middle school, I ended up taking this advanced science course at a college where I got to do experiments, and it was really fun. And we actually tested like lake water or river water, I think it was, and I really liked it. And then in college, I started to think about science as a way to make an impact or try to provide evidence for improving healthcare for underserved individuals, and that really continued my motivation to a different level. After college, I did research work. I thought I wanted to get a PhD in clinical psychology, and then I ended up getting very interested in public health, and in public health I really started thinking about this idea of co-occurring epidemics like HIV and substance abuse and mental health issues, and how they exacerbate one another over time and perpetuate disease burden on vulnerable populations. And that really got me to where I am today. I'm recently starting the postdoc, so my days are looking a little bit different than they were in the past, but up until now I've had some clinical work, so I see patients one-on-one or in a group setting, and then I do quite a bit of research, clinical research. So I might see someone in a clinical research setting where I'm asking them to answer questions, or getting maybe viral load data, so blood or something like that. And then I would say, quite a bit of time sitting and kind of analyzing data or looking at outcomes and thinking about how it fits in the broader scheme of the current literature. I'm very interested in the way problems like emotional problems and also behavioral problems like using substances contribute to taking or not taking care of oneself. So for example, an individual who feels really bad about themselves and who might be using drugs to feel maybe a little bit better or not feel might be less likely to take their medication that they need to survive, or might be less likely to protect themselves or other people from the spread of an illness like HIV. The evidence thus far is really showing that thinking about maybe both the emotional problems and the behavioral problems at the same time might be the most effective way to reduce the high-risk behavior, like maybe sharing an illness that you don't want to share, or engaging in self-care, or like taking one's medication. So if I feel a little bit better about myself and my mood is a little bit better, and I'm able to maybe stop or reduce the substances I'm using, I might be more likely or better equipped to take care of myself and others. Trauma is a complex thing that is really integrated into a lot of our the way our bodies work and the way we act and the way we feel about ourselves. It's a complex thing to work with as well. So we have a lot of trauma-informed therapies, for example. I worked in an HIV clinic in northern Manhattan when I was doing my MPH at Columbia, and I began to see people living with lots of different problems, and this idea of syndemic theory really emerged as important. And this idea of, you have substance abuse, you have poverty, you have HIV, you have maybe domestic violence, and all of these things are making your life really, really hard, and it's really hard to get any better. And then there's somebody who is somehow doing better or doing okay or getting a little bit better over time. And I think that really brought into focus this idea of resiliency, and that got me really excited and thinking about public mental health and how, as a psychologist, you can kind of improve or help people improve their own state of being despite these co-occurring problems. And that really was instrumental in helping me see that mental health care and clinical psychology could make a big impact on a public health level.